What if one of the most popular weight loss drugs today comes with risks most people aren't talking about? And what if some of the benefits are not as clear as we thought? Welcome to Science My Health, your channel for health and research information. Why everyone is talking about GLP-1 drugs. GLP-1 medications have exploded in popularity. They are used for type 2 diabetes and, more recently, for weight loss. The reason is simple. They help control appetite and improve how the body handles blood sugar. But as more people start taking them, a bigger question comes up. How safe are they outside of the research involving very stringent controlled clinical trials? That is where this study comes in. Instead of a small, controlled group, researchers looked at hundreds of thousands of real patients across the US to see what actually happens in everyday life. How this study worked. Researchers did not just look at people taking these drugs in isolation. They compared them to other common treatments doctors would realistically prescribe. They looked at two main groups: people with type 2 diabetes and people using medications for weight loss without diabetes. Then they tracked what happened over about 6 months to a year, focusing on serious health outcomes like heart attacks, gallbladder issues, liver injury, and mental health events. To make the comparison fair, they adjusted for over 80 different factors, including age, medical history, and existing conditions. So this is not just surface-level data, it is designed to reflect real-world decision-making. The most consistent risk. One finding stood out clearly. People taking GLP-1 drugs were more likely to be hospitalized for gallbladder or bile duct issues compared to people on other medications. Here is a simple way to think about it. These drugs change how your body processes food and fat. That shift can affect how the gallbladder works, which may increase the chance of problems over time. This does not mean it happens to everyone. The overall risk is still low, but it showed up consistently across both diabetes and weight loss groups, which makes it important. What about heart health? A lot of people assume these drugs help protect the heart. In some clinical trials, they do. But in this real-world study, the results were different. Rates of heart attacks and strokes were about the same between people taking GLP-1 drugs and those taking other treatments. This does not mean the drugs do not work. It means they did not clearly outperform other options, especially when those options, like SGLT2 inhibitors, also have heart benefits. The takeaway here is more nuanced. The benefit may depend on the person and what they are being compared against. The study also found some potential upsides. In people with type 2 diabetes, GLP-1 drugs were linked to a lower risk of acute liver injury compared to another major drug class. There was also no clear increase in suicidal thoughts, and no strong evidence of increased thyroid cancer risk in the diabetes group. So while there are risks, there are also signals of potential benefits, especially related to liver health. What this means in real life. Here is the big picture. Most serious side effects were rare. Even when risks were higher, they did not happen often. But there are trade-offs, including a small increased risk of gallbladder problems, no clear advantage for heart outcomes in everyday settings, and possible liver-related benefits. Another important detail is that many people stop taking these drugs within months. That matters because how long you stay on a medication can change both the risks and the benefits. So, what should you take away? GLP-1 drugs are powerful tools. They can help people lose weight and manage blood sugar in ways we have not seen before. But they are not a shortcut without consequences. The real takeaway is not that these drugs are good or bad. It is that they are complex. And understanding that complexity helps people make smarter decisions about their health. Like this video and subscribe to Science My Health for more easy-to-understand health research news.